see if I get this right there. Just to start, that actually is an Impia photograph that I absolutely love because it sums up what we're about. We're about victims, and that is an evocative photo for us. We use this every place, and it's our favourite one because it reminds us what it is we're here to do and what we're about. Now, I've been asked to talk about lobbying, and I've never been asked to talk about lobbying before. We do it, but I've actually never thought about it before. So I thought I'd start by saying to you, lobbying is intrinsic in the human nature. We've done lobbying as human beings since we were so high. And it's about trying to get somebody to do something that they don't always want to do, but you want them to do it. We're probably unique as a charity in that we focus exclusively on elder abuse, and we do not do anything else except elder abuse. But we focus it from the point of view of the victim. We talk about the silent scream. The silent scream from all those old people out there who cannot tell us, for whatever reason, what's actually happening to them. And they live at home, and they live in care homes, and they live in hospitals, and they live in all sorts of places. But what they do not have is a voice, and we seek to give voice to them. And I have to say to you at the outset, there are a number of different perspectives about elder abuse that it's worth us always remembering. There is the perspective of the abuser, why they're doing it, what's causing it, and we have to understand that perspective if we want to do something about it. But there is also a perspective from the statutory sector, and there are times when we and our statutory colleagues very, very strongly disagree about the approach, the style and the thinking because of the third perspective, which is the victim. And a point I often make to people is, it does not matter why you're doing it. It does not matter that you're under-resourced or you haven't been trained properly. From the point of view of being on the receiving end of it, it hurts. It is abuse. And that should be our measurement of whatever we're doing. Not anything else other than, does it hurt that person? Does it harm that person? And what do we do to stop it? And that's our starting point. We've been campaigning and we've been lobbying around elder abuse, certainly since around 2002, when we really got going on this issue. And you would think, like I'm sure all of our colleagues internationally, that we should have an easy task of this. It actually isn't easy to identify what's going wrong and what's actually happening to people. When we had our prevalence study, and we've recently had it reanalysed, we came out finally with an 8.6% issue on elder abuse. That's 500,000 people. Now put that against a million children a year being abused, where there is millions of pounds being invested, millions of pounds, and against what we're actually doing to protect our old people. And you have to ask the question, why is it that we're not actually dealing with the issue of the abuse of old people with equal parity, equal seriousness than we are actually with children? And in fact, I have to say to you, we're better at protecting our animals than we are actually protecting our old people. We have better legislation in the UK at protecting our animals. We've got 150,000 instances of cruelty to animals in a year. Put that against the number of old people, and we do something like, don't hold me to this, something like £50 million to protect our animals. Nothing like that to protect our old people. You have to ask why that is. And when you look at the profile of the victims of abuse, and this is fairly consistent across all of our nations, the picture that we're talking about are extremely frail, extremely vulnerable old women who are the victims of abuse. Now, it's an interesting point for me that when I look at what we're doing in the UK around domestic abuse and domestic violence, we forget old women. Domestic abuse does not grow old in the UK. We have not actually got our heads around the fact that we can actually be abused as an old woman in our 80s and 90s as much as we could in our 20s and 30s. And yet we've got better legislation to protect people. And I often wonder, what does it say about how we judge our societies when you look at what happens to some of our old people? And I am focusing exclusively on old people. Now in the UK, I could say to you that we've got some aspects of legislation that should be working. And like I've said to you, I've identified there domestic violence. A high element of domestic violence should be addressing towards old people, and yet it's not. And some of what we're doing, and I wanted to share this with you, because a point I say wherever I go, there are consequences of social policy decisions that we take today that will come out and haunt us tomorrow. Can you see how high those yellow bars are? 15 years ago, they were nowhere near that. That's forced me to stop talking about neglect, per se, and talk about deliberate, willful, intentional neglect on one hand, and passive neglect on the other. Because what we've done over the last decade and a half in the UK is cut and cut and cut the services to older people. And when I was running domiciliary care services in the UK, what I could give to older people is nothing like what's available today. It's almost non-existent. The people who needed support at home did not go away. They still need support today. They rely on family and friends who are not equipped or skilled to actually deal with it. So we saw a huge increase in what we call passive neglect, unintentional neglect by family and friends who are trying to do what should have been done by statutory care and is no longer being done by statutory care. There is a consequence of the decisions that we take, and we can't pretend that that's the case. Every time we say we can't afford it, there is a consequence of that. Every time we say we have to tighten our belts, what we actually mean is we're going to hurt somebody. And I think we need to call it for what it is. This is why, from our point of view, we speak out very strongly and very clearly on the reality for people. And let's not mince it up and fancy the words. And this is the reality. We are hurting people. And the fact is, we're providing poorer and poorer care, and I would say to you with that in context, we've got about 35 years, if not more, of regulating care provision. Domiciliary care, residential care. We're doing it worse now than we've ever done it. We've gone backwards instead of forwards. A point I'll say to you some point later in this is you cannot regulate quality into care. You have to motivate people to want to do it and believe in it with a passion. Regulation by itself does not give you the reassurances that you want, and I know that's not what's been said. Regulation cannot give you quality care. By any estimate of what I use when I think about victims, I have to say to you, our care systems in the UK and elsewhere are creaking at the seam, and our commitment to protecting people is highly, highly questionable. We are making decisions at times that we know are actually not going to help anybody, and we need to face those realities. The legislation is great, and I have been fighting for legislation for ages, but legislation without adequate funding, without an intent to deliver on it, becomes no more than a paper exercise. You have got to want to make a difference. And what I'm not seeing in what's happening in the UK, and I'm going to split this into the nations in a minute, is that commitment to actually make a difference. And I think that's the motivation that we've got to think about. Now, I have to say, in most of the UK nations, other than Scotland, there's a marked reluctance to actually address elder abuse. When you see what comes out from England, from Wales, and to a lesser extent from Northern Ireland, people tell you about the systems and what we're planning to do in terms of the processes. And that's what we saw, for instance, from our Wales colleague. The processes, the system. They will not talk about the difference that it's making. Have we actually helped people? Is it actually effective on the ground? Because we can't answer those questions, other than in Scotland, where they moved forward in 2007 with a comprehensive piece of legislation that gave us structures and systems and powers of intervention, and that's the key point. There's no point in us identifying abuse if we don't have the ability to follow through and actually do something about it. And that's the reluctance that we often see. You don't want to interfere in family life. You do when it's domestic abuse, but you don't for anything else. That's the reluctance of our politicians in terms of what we're trying to do. We have created what I call hierarchies of vulnerability, and we should never have done this. People are vulnerable, that should be enough. And yet what we've seen is animals come before humans, except foxes, because over in England they're like, animals come before humans. Children come before adults every single time. And we're even starting to see a grading of who's the most serious in terms of adults that are left. Is it older people? Is it learning disabilities? Is it mental health? How do we get into that? How do we actually end up down that road where we have to compete for protection, where we're putting one group of vulnerable people against another group of vulnerable people? There's something fundamentally wrong with what we're doing. And here's what I think. I think basically we're creating societal permissions for people to behave in certain ways. By not responding powerfully with a huge, huge outcry, we're giving permissions. Point I very often make about nurses. The Nurse and Midwifery Council strikes nurses off. Yes, it has got much better at striking nurses off. But when are we going to start to ask the question, what takes a nurse who joins the profession maybe 15 years ago for all the right reasons, what's the path, and it's often she, what's the path that she follows to that day when she's struck off the register? Why has it happened? What has been done to that person to take all that commitment and energy and enthusiasm and turn it into somebody who's neglected or abused? If we don't understand that, then the only tick box we're ever going to have is struck off. We're not stopping it. We're just intervening after the event. Someone once said to me, we're so busy pulling people out of the river, we're not going down the bank and seeing who's pushing them in. We've got to stop. We've got to stop this. We have got to start preventing instead of simply intervening. And that's about us. Us being placid and us being quiet and us accepting it and saying it's just a one-off incident or it's just the occasional one. The occasional one is one too many. The occasional one says to everybody else, it happens. It should not happen. We should have, to use this horrible phrase, the zero tolerance towards abuse, whatever that abuse is. How does this end up in reality translating? Well, let me give you an example of this. Here's a statement from a case that we were dealing with some time ago, and it's about a man who had hit out and struck his wife. Now, 70 years of age, that man got wrapped in cotton wool. Daycare was organised for him. His wife was put into daycare regularly. He was given domiciliary care service. He was given a network around him because he was seen as being a carer who couldn't do any more than he was doing. Actually, it was a statement from a 25-year-old who was seen as being a serial abuser of his wife. And yet when I present it to people at being 70, they don't see the wife as the victim. They see that poor old man and all the troubles and strife he's under. And that's how we're losing some of the abuse. We're not looking at the victim. We're looking at who's doing it, and we're immediately in our ageist mentality thinking it's okay. There's the reality for me, and I cannot forget this case. 81 years of age, she called the police time and time and time again, and they came and saw an old woman. They did not see a domestic violence victim, despite all the training, despite all the focus, and she died as a result. And that is not an unusual thing. We have got to see abuse, not the age of the person, not the circumstance of the person. We've got to see abuse for what it is. And we need to deal with what's at the heart of a lot of what we're addressing today, and that is age discrimination. Our ability to see old people as somehow lesser. Why is it, folks, that we all want to get old, but we don't want to be old? You will not find anybody who says, I want to die young. But you won't find anybody who says, I want to be an old person. You'll find lots of people saying, I want to be a cantankerous old person. And I think we all want to be that. But that's at the heart of our problems. That's we have got to address what is happening in our societies and why are we marginalising and putting people and hiding them away or forgetting about them, or when you hear it next door saying, I don't get involved in that, whereas if there's a child screaming out, you would do something about it. What is it that we've actually done? Now, I'd liken the situation in the UK, to give you a very, very fast overview of what's happening, to a horse race. You're thinking about in terms of adult protection legislation, if you're thinking about how it goes, Scotland started the race, got through it, and is almost at the finishing point right now. If we can afford £50 billion to do a high-speed rail link from London to Manchester to shave 15 minutes off, isn't that about priorities? And when we, as a country, launched attacks on Libya, and I'll be political here because I can be, when we launched attacks on Libya, we weren't at war with Libya. Do you know we fired 15 cruise missiles at Libya? They cost us £1.3 million each, and they tell us we can't afford to protect our old people? This is about the priorities that we're putting on our money, on our expenditure, and how we do it. The UK is not a poor country. The UK can afford to look after its old people. It chooses not to do so. It places its money elsewhere. I did say it was political. There you go. Basically, the reality for us is we need to change the focus onto the causes of abuse and stop just looking at the nature of the victims. We've got to start understanding we deal with the causes, not the symptoms of abuse, because if we don't deal with the causes, this is going to carry on forever. And much of what we're doing is about dealing with the symptoms. We've got to win people's hearts and minds. This has got to be not about I'm regulating you to do it, or I will take you to court and put you in prison if you don't do it. This has got to be about people want to do it. They feel that motivation, that desire. They do not want to do a bad job. We've had, to take the Lee's Crosses and the others that we've had over. How many people worked in Lee's Cross? Was there not one of them who wanted to come forward and stand up and say this is wrong? And if there wasn't, why not? We had a horrendous case in terms of learning disabilities a couple of years ago, and we got our panorama in and we uncovered it all. It took one man to go in there and say, I'm not putting up with this. This is not what I'm in the profession for. And when he couldn't deal with it internally, he went to the media. That's what we need. People like that who say, these are my standards, and I'm not putting up with it, and I'm going to change it. And that's what our target is, and that's what we're trying to do. Yes, we want the legislation. Yes, we want good regulation. Yes, we want all the rest. But at the heart of it, we want to change the culture, the thinking about old people, and what actually makes a difference. So what makes for good lobbying? Well, if you follow strictly what they tell you, then clearly one of the issues is be clear on what your demands are, be specific on what you want to achieve and why you want to achieve it, and make it simple. Because people understand simple messages much better than they understand complex messages, so keep it simple. I'm told the best way of doing it is about building alliances. Don't try and do it on your own. Get a group together to actually push forward and make a difference. This is the theories I'm giving you now, okay? You've got to be persistent. You've got to keep going. You've got to keep the message being driven home to ministers and governments and others about what you want and why you want it. You've got to have champions. We set the Silver Line Loneliness Helpline up, and we got Esther Ranson in to do it as the champion. We got so much coverage on that, it was unbelievable. By the way, the reason we did it is because one of the issues for us is isolation and loneliness creates the grounds for people to be abused. So if we reduce isolation and loneliness, we reduce the potential for abuse. That's why we did it. But you need your champions. You need the people who are going to stand up and be the public face of this and make a difference to it. And you make it easy for ministers to agree. Now, that's the theory. That's the theory of it. Do you know what the reality is for us? And this is the painful reality for us. There's only one way of guaranteeing that anybody will listen to you. And that's the panorama programs for us. Getting the media, getting the picture into people's front rooms and keeping it in people's front rooms. It isn't the reports. It isn't people sitting down and chewing the fat over, isn't this awful? It's the pictures in the front room, and that is the only thing that makes the difference. When we pulled off, because we thought we'd done it, when we pulled off the pedal in terms of the media, the ministers stopped listening. So the first thing I say to you is politicians only listen to the media. It's a horrible thing for me to say, and I'm quite sure there's lots of very nice people who are ministers. But the reality is, the only time they sit up and take notice is if it's endangering them, if they've got to actually be answerable to the public. So that's the first thing I'd say to you. The second thing I'd say to you is that when you get the media, others get involved. We've got some great large older people's charities in the UK, the biggest one being Age UK. Age UK engage with us on lots of times, but they really engage with us when we do the media work. They really like that. So you get other people involved when you do the media work, and you get funders. Now, one of the important things for me to stand here and say to you today is my money comes from trusts and foundations and members of the public. It does not come from governments. They cannot shut me up. And that's the important thing. They gave me £120,000 a year for 3 years, a number of years ago. And 2 months after giving it to me, they called me in and said, you can't say that. You want our money, you can't say that. We're going to have to work together on this. Do you know what my response was? Who do I write the cheque to give it back? Because you cannot be in someone's pocket and speak out for vulnerable older people. You have got to be independent, and that voice has got to be clear and specific. So the final point I'd say to you is the media makes people angry, and you need people angry about this issue. Not debating it, not discussing it, not saying how awful it is, but downright angry about it. How dare you treat old people like this? How dare you behave in this way? Who do you think you are doing it? Whoever that person is, whether they're a family member, whether they're a care worker, or whether there's somebody justifying how it happened and how it went wrong. Care providers, yes, are responsible for quality of care. There is no doubt about that. But I happen to take a slightly different view than what's just been said, which is I don't make any allowances. Don't tell me you didn't know. Don't tell me you didn't understand. You got involved in care, have your own standards and deal with it from day one. Do you know what I really hate is when a care provider tries to say to me, it was down to training, I wasn't trained to do it. You do not need training to know you don't treat one human being and another human being like that. That is below that level. You need training to know how to use a hoist. You do not need training to know how do you care for people. And I really, really, really get angry when people say that to me. You may have noticed. One of the sad things to say to you, and this is the reality for us, and I say this to you for 14 years now as Chief Executive of an abuse charity. We have the moral high ground. It means nothing. That means I'll get a cup of tea and a cup of coffee in the minister's office. Doesn't mean I'll do anything about it. You can command the moral high ground only to the extent you can use it, and I can use it in the media. But there's no point in me saying I can win the arguments, because when it comes down to, will you convert that into action, they'll tell me how they haven't got the money to do it. Moral high ground doesn't work. It's useful, but it doesn't work. My second point to you is systems, procedures and policies serve a purpose, but they are not the most effective way of doing it. Because all the time you've got people saying, that's what the procedure says, they're not using that. And what we need is that phrase, intelligent intervention. How do I do it in a way that does the least harm to people? How do I do it in a way that makes sure it's the most successful outcome? And just as an aside, because I heard a bit this morning, we've got a brilliant piece of legislation in England called the Mental Capacity Act. Fantastic. Really, if I could take the principles of the Mental Capacity Act and apply it to everybody, I would, because it talks about proportional intervention, it talks about stage intervention, it talks about putting people at the heart of things. We've got one problem with that, and this sums it up here for you in terms of intelligent intervention. People are so focused on assessing, does somebody have the capacity to make a decision? They've not thought, do they have the capability to carry it out? So we're having people assess as having the capacity and then walking away. And yes, they've got the capacity to make a decision. We've got lots of old women. I'm going to generalise, do not shout on me for this. We've got lots of old women who are victims of abuse because when they were younger, the partner looked after the family income, the partner did all the budgeting, and when the partner dies, we might give them bereavement counselling, we might assess whether they have the capacity to add up. You know, across our minds to think, do they have the capability to do it after all these years? There's two sides of the same coin. We've got to think capacity and capability, intelligent intervention. And we need, and I love these phrases, we need policy that's based on evidence. What do we have? Evidence-based policy. They will make their minds up about what they want to do, and then they'll go away and tell the civil servants, find me the evidence to back it up. That's not what we want. We want people to look, to understand, to appreciate what's happening, and then to develop the policy from there. So we want policy-based evidence, not evidence-based policy. But I have to say to you, and this is my painful experience, if you let them, ideology will take the place of reality every single time. And they will find ways of justifying what they're doing to fit their ideological thinking. The arguments that I have heard down the years about people have the right to make choice and control, because ideologically that's a brilliant statement to make. And yes, it is. What about coercion? What about undue influence? What about being in a family situation where you have no choices, but you're saying yes? It's not enough to have ideological objectives unless you understand what does it mean in reality for people who are living it every single day. And the bottom line is the vast majority of elder abuse happens in our communities, in our families, behind the family closed door, where we put all our resources, our legislation, our energy, into the smallest part of it, which is paid care provision. Why? Because it's the safest place to look. We've got to force people to look elsewhere and see abuse for actually what it is. Am I making sense? We've got to see it as it is. Here's the point. Lobbying is not about being heard. I've been heard lots of times. Ministers called me in. We had some people who were champions of older people when they were MPs. They got in to become ministers and suddenly their championship whittled away. They called me in. They heard everything I was saying. They listened to a word I was saying. They thanked me for it, off they went. So you've got to be listened to. You've got to be heard, you've got to be listened to. Got to be a starting point. There's no point in being right. You've got to be tenacious. You've got to keep on going. Because being right and making the right arguments, as I discovered, is of no value whatsoever. They told me I was right, they didn't do anything about it. You've got to be tenacious and you've got to keep on. And at the end of the day, you've got to be the last one standing. We are the last ones standing. We've had 15 years of them playing at protecting people, playing at safeguarding, and they've all gone away and we're still here. When I'm still here, we're growing and expanding. You've got to be you've got to be prepared to say, I don't care how long it takes, you're going to change. We're not going to let go until you change, because that's fundamentally what's got to make the difference. And at the end of the day, this has never been about us, and it never will be about us. When we think World Elder Abuse Awareness Day, do you know what we think? That's what we think. We want old people fighting back. It's not enough for us to be the advocates. We've got to make this owned by them, and they've got to fight the battles. Because at the end of the day, they can't argue with them, they can argue with us. That's lobbying. Thanks for listening today.